His topic is a spectrum of two cases of foveal hypoplasia.
Yeah, good morning all. I would like to thank AIOCMTC4 for giving me this opportunity to address your August gathering. I can't see my slides, please. Yeah, so I'll be presenting on a spectrum of two cases of foveal hypoplasia. Foveal hypoplasia is absence or poor definition of the foveal pit at center of macula, commonly associated with albinism, aniridia, achromatopsia, microphthalmia, nystagmus, and ROP. Fovea plana is basically an absence of a foveal pit, but the foveal cone specialization is preserved anatomically and functionally with a good visual prognosis. It was suggested by Marmer et al. Optic disc pit occurs due to the failure of closure of embryonic fissure. It's a type of congenital cavitatory anomaly. Other anomalies include extrapapillary cavitation, optic disc coloboma, and a morning glory syndrome. So it's basically a solitary ovoid gray-white excavation in the inferior temporal quadrant, about 1/4 of the disc size. 25 to 75% of these cases will develop an ODPM at some stage in their life. So our first case, a 12-year-old girl presented with complaints of decreased vision in the left eye since 5 years. There was no significant medical or ocular history, no preterm birth. The best corrected visual acuity in the left eye with was 636 with -3 diopters, and the axial length was 23.5 mm. The slit lamp examination, anterior segment was normal with notably no transillumination defects, no nystagmus. The fundus was normal with no albinotic features, but the fovea had an ill-defined maculofoveal area. On the autofluorescence, a normal FAZ is seen in the right eye, while the left shows a smaller FAZ. The right eye OCT was normal, while the left eye showed persistence of the inner retinal layers, absence of foveal pit in the foveolar area. While the second case, this 14-year-old girl came with the complaints of decreased vision in both eyes since 1 year. Again, there was no significant medical or ocular history, no preterm birth. The right eye, she was 6'9" with plus 3.5 diopters. The axial length was around 20 mm. Anterior segment was normal with notable no transillumination defects of iris, no nystagmus, no albinotic fundus. The optic disc had a pit in both eyes. The fovea showed an altered FR in the right eye. Fundus photo showing a vitreous veil, optic disc pit temporally in both eyes, and an altered FR in the right eye. On autofluorescence, the FAZ is again smaller as compared to the left eye. The right eye OCT again showing an absence of foveal pit with persistence of the inner retinal layers. The cone widening is present, outer nuclear layer widening is present. So it was a grade 2 foveal hypoplasia. The left eye was normal. We followed up after 6 months. She maintained the visual acuity with a similar diagnosis. So foveal development starts about 14 to 22 weeks of gestation, continues till about 13 years of age. There's first an outward displacement of the inner retinal layers, followed by cone photoreceptor specialization, followed by inward migration of the photoreceptors. So there's a single layer of cones by 20 to 22 weeks. By 25 weeks, there's an outward displacement of ganglion cells, inner plexiform and inner nuclear layer, which forms the foveal pit, followed by growth and length of the cone inner segments by 29 weeks. The foveal pit appears completely by 15 months, and the cone density continues to increase till about 13 years of age. So foveal hypoplasia occurs when the foveal pit either fails to develop during any one of the 3 stages. It may be associated with a poor visual acuity, also may be associated with nystagmus. Can be seen associated with PARC6 anomalies, SLC38A8 anomaly, FRMD7 anomaly. This was graded on OCT by Thomas et al. A normal OCT, as we all know. On stage 1A, there is extrusion of the plexiform layers. 1B, extrusion of the layers with a shallow foveal pit. On 2, the foveal pit is absent. In stage 3, the cone widening is absent, and stage 4, outer nuclear layer widening is also absent. Atypical when these features are associated with some drusen or PED anomalies. So this case was reported in a 9-year-old boy, ill-defined maculofoveal area with a less delineated foveal reflex. The left eye showed absence of foveal pit, and as the classification by Thomas, it was again grade 2. Before this, these cases were not reported. Only 3 had been described before this report, all with varying degrees of vision loss. It has been reported with albinism. As can be seen, the foveal contour is not noted on OCT. In patients with aniridia with PA6 anomaly, the foveal contour is absent. In posterior microphthalmos, again, foveal pit is absent. In ROP, it can be seen post-laser. While optic disc pit, the incidence is about 1 in 11,000. It's bilateral in about 15% of cases. The various differentials needs to be differentiated from ONH hypoplasia, morning glory syndrome, and coloboma. It has been reported with Aicardi syndrome, Algale syndrome, bilateral renal hypoplasia, bilateral keratoconus, but there's no reported case of ODP with unilateral foveaplasia. This was a nearly similar case, but there was septo-optic dysplasia with fovea plana. The foveal contour is absent. Grade 2, as identified by the OCT classification, decreased visual acuity was due to optic nerve hypoplasia. Another ophthalmic image was published which showed an optic nerve head pit with sectoral inner retinal hypoplasia. So to summarize, my first case had unilateral foveaplasia, hypoplasia with decreased vision, about which few case reports exist. Second case had good visual acuity, but it has not been reported before. Multimodal imaging helps in the diagnosis. We published our first case in DJO. The second is under publication. Thank you.